Welcome back to the Elias Makos Show. Now, it was just a few weeks ago that we lost one of our own. We lost Egbert Gay, who was a frequent panelist on this program, on the Big Five. Every week you could count on Egbert Gay. He passed away a few weeks ago of a heart attack. And with that in mind, we wanted to take some time on this program to talk about cardiovascular diseases. 32% of deaths worldwide due to cardiovascular diseases. So we want to talk about that. We wanted to talk about heart attacks and the risks and prevention, as this is something that can affect anyone at any time. So with more on this, we're going to go now to Dr. Christopher Labos. Of course, he's a cardiologist, and you'll hear him on Weekends with Ken on Sunday mornings at 8:10 with his checkup on the radio. Dr. Labos, thanks for coming on the show.
My pleasure. Thank you for having me.
So let's talk about heart attacks. I guess they're a result of other cardiovascular issues. Why don't you tell us a little bit more here?
So, there are many different reasons why somebody can have a heart attack, but sort of run-of-the-mill coronary artery disease, the one that's responsible for the majority, it's not the vast majority of cases, is really driven by what we refer to as traditional risk factors. So blood pressure, cholesterol, diabetes, smoking, exercise, and diet. Mm-hmm. Those are the things that really determine how much plaque, how much atherosclerosis builds up in your arteries. And this is a lifelong process. It's not something that happens from one moment to the next. It is something that happens over the course of your lifetime. And the more of these risk factors you have, the more plaque starts to build up in your arteries, and that's how we end up with blocked arteries. And when we have unstable plaque, which is a bit of a slightly different thing, that's what can predispose people to having a sudden acute coronary syndrome, which is a heart attack. So you sort of have two related but slightly different processes: the slow accumulation of plaque that leads to blocked arteries and causes angina, and the unstable plaque that can rupture suddenly and cause a heart attack.
What can we do for prevention? Well, what should we be thinking about when it comes to preventing this?
It's really controlling the risk factors. If we could get everybody on the planet to not smoke, exercise regularly, maintain a healthy body weight, eat a normal diet, and also control high blood pressure, cholesterol, and diabetes, we could probably eliminate, estimates vary, but you're talking about somewhere around 80 to 90% of cardiovascular disease. Some of it is obviously genetic and some of it is age-related, but a lot of it can be driven by risk factors. And so if we could eliminate all of these, you would see a very precipitous drop in cardiovascular disease. Now, there's obvious limitations to all of this, but it just goes to show you that a lot of people are worried about genetics, they're worried about family history, but a lot of your cardiovascular risk is manageable. It's just a question of really aggressively treating risk factors as much as you can.
Are there warning signs for a heart attack? Are there warning signs, a month earlier, 6 months earlier? Is that a thing?
It depends. It sort of depends. Here's the thing. We are sometimes, when we speak about this colloquially, a little bit imprecise in our terminology. Mm-hmm. If what we're talking about is a heart attack, that is a sudden rupture of an unstable plaque. And that, by definition, is a sudden event. Like, you were fine right up until the point when the plaque ruptured, and that's when the blood flow to your heart was blocked. So in that circumstance, really what you have to do is get to a hospital so that artery can be unblocked. And that is the problem, especially when people have atypical symptoms. They say, I have this weird sensation in my chest. I'm not sure if it's a heart attack or not. And it can be very hard for people to know. But you're essentially fine right up until the moment when that sudden rupture happens. And that's what I think a little bit difficult for people to understand. A lot of people think that a heart attack happens when you have an artery that goes from 0% blocked and slowly worsens to go 10, 20, 30, 40, 50, 60, 70, 80, 90% blocked, and boom, suddenly you have a heart attack. That's actually not what happens. 90% blockages that are there for a while don't actually rupture. They are what's referred to as chronic blockages. They are calcified, they are hardened, they are stable. It's the 10, 20% plaque that will rupture suddenly and cause a heart attack. So having a stress test beforehand isn't going to predict the heart attack necessarily, because a stress test isn't going to pick up a 20, 30% blockage that's not impeding blood flow in any significant way.
We are talking about cardiovascular disease and heart attacks with cardiologist Dr. Christopher Labos. So putting heart attacks aside for a moment here, on cardiovascular disease, what are the things that people should be listening to their body about? What are some of the things, if your body gives you some indications, talk to a doctor?
Well, if you're having chest pain, then, you should probably get that checked out. If you're having shortness of breath, if you do not have the same degree of exercise capacity that you used to have, that's worth getting checked out. You will hear a lot talked about and written about atypical symptoms, and that is true. A lot of people do have atypical symptoms, but the majority of people with heart disease still do present with either chest pain or shortness of breath. So while atypical symptoms are possible, the more typical symptoms are, in fact, the most common ones. And so anything in that, range, it's a symptom. It should get checked out. Now, it's a fairly easy thing to diagnose. If your question is, do I have a blocked artery in my heart that is impeding blood flow and causing chest pain, doing a stress test will tell you if there's a blocked artery there or not. It is a very simple yes/no question that can be answered. But in terms of decreasing your risk long term, that's where you have to look at risk factors: blood pressure, cholesterol, diabetes. And what's problematic about those is that you don't actually feel anything. They are largely asymptomatic conditions. That's what requires screening. And in a situation where a lot of people don't have family doctors, that's where you start to see a lot of screening maybe fall by the wayside, which is potentially quite problematic.
Dr. Labos, let's just talk a bit about demographics, whether it's sex or race. Are there any other factors we should be thinking about when we're talking about cardiovascular disease or heart attacks?
Honestly, the big one is age. Heart disease just becomes more and more common as we get older. That's just the unfortunate consequences of life. So, if you're 20 and 30, the likelihood that you have heart disease is frankly almost trivially low. Not impossible, but very, very low. And as you get up into, your 60s and 70s, well, the risk just starts to go up. So it's really age that really drives a lot of this. The male-female split, men tend to get heart disease a little bit younger than women by an average of about 10 years, but that's a bit of a rough estimate. And, even women can get atypical symptoms of heart disease at a young age. That's not as hard and fast in rule. Race is a much more difficult one to sort of nail down as a real risk factor. A lot of the data comes from the U.S., where it's really tied up into access to medical care and socioeconomic status. So it's really hard to tease out if there's an actual biological reason there or not. And frankly, at the end of the day, a lot of cardiovascular risk prediction can be individualized. So it doesn't matter whether the population as a whole high blood pressure. It matters if you have high blood pressure and whether that's being treated. You can control your own risk factors. And these are really easy things to check. It's really check your blood pressure and get a blood test to look at your cholesterol and your blood sugar level to see if you have diabetes. This is easy to do. It just requires proper medical follow-up.
Dr. Labos, to wrap up here on when the time is to either call 911 or get yourself to a hospital as soon as possible for a heart attack. What can you tell us, and what should people be thinking of in that worst-case scenario?
The reality is most people present too late. Most people delay too long because they have weird symptoms. They're at home. They're not sure if it's their heart or not. They think, maybe it'll pass. Frankly, if there's a doubt in your mind about whether you're having a heart attack, if you say to yourself, I wonder if this is a heart attack, I wonder if I should call 911, you should probably call 911 at that point. If the thought enters your head, you should probably do it. The worst that's going to happen is you're going to get sent home. And yes, I realize you're going to wait a long time at the emergency room. And yes, it's going to be a burden on you and your family to go through the process. But it's better to do that and waste your time than to risk staying at home too long. And I think that's the general consensus. And we'll be able to know in the emergency room if you have a heart attack or not. We check your blood enzymes to see if there's signs of cardiac damage. We do an ECG. A lot of that can be done pretty efficiently and pretty straightforward. So it's always better to over-consult and under-consult for things like this that can be potentially life-threatening.
Dr. Labos, we're going to leave it there. It's always great talking to you. Thank you so much for your time this morning.
All right, you take care.
That's cardiologist Dr. Christopher Labos. You can hear him on Sunday mornings on Weekends with Ken at 8:10 a.m.